The Africa CDC the Africa Centers for Disease Control and Prevention is currently holding a media briefing on COVID-19 responses on the continent. Africa CDC Director Dr. John Nkengasong is currently giving an update. Let's take you there live.
All right, so that's the introduction for today. When we do come to that question and answer section, please utilize the WhatsApp number +251 94 550 2310. Let me give you that number again. It is +251 94 550 2310. But you can come through online and also utilize the question and answer section. Today, unfortunately, we'll not be able to come to you in French. Our French interpreter has been held up and is not able to attend today. So the whole briefing will be in English. So let's get straight into the briefing. And let me say good morning and welcome to Dr. John Nkengasong, who is the director of the Africa CDC, for his usual briefing on COVID-19 in Africa. Dr. John, good morning, and you have the floor.
Good morning, Wayne, and good morning to everyone. Greetings from the Africa Centers for Disease Control and Prevention. And today, as always, I will give you a briefing on three things. Give you an update on the epidemiological situation of COVID in Africa, then discuss some of the events that Wayne touched on, and conclude with the situation of vaccines and vaccination in Africa. So let's start with the epidemiological update of where we are. As of today, December 9, a total of 8.7 million cases of COVID-19 have been reported on the continent. Of this number, 224,000 people have unfortunately died. If you look at the case fatality rate, it's still around 2.5%, which is it has been very stable, but there are some exceptions, with countries like Egypt, Somalia, and Sudan reporting case fatality rates of 5%. With respect to the wave, we have seen and enjoyed a downward trend over the last couple of months, but we are beginning to see a ticking up, but we have to interpret that very carefully. As we speak today, 12 countries are actually experiencing a fourth wave. And South Africa is in that number of countries now, given the number of the increasing and steady number of cases that we are seeing. And Mauritius is now experiencing the fifth wave. We expect, unfortunately, that we'll continue to see this trend, especially as the holiday seasons are coming up, and we'll come back to that towards the end of our discussion. In terms of the variants, let me just focus today on the new variant, the Omicron. A total of 11 African countries have now the Omicron variant, the variant of concern. 7 additional countries have reported the presence of this variant since we last met last week. So let me just read the number of countries that have reported this variant: South Africa, Botswana, Nigeria, Ghana, and since last week, we've added Uganda, Zambia, Senegal, Tunisia, Mozambique, Namibia, and Zimbabwe to the list. In terms of the changes over the last 1 week, we know that between the week of 29 November to the 5th of December, we have seen the continent has reported a total of 98,000 new cases. And this represents an average increase of 88%. The highest number, keep that number in mind, the 88%. If you now look at the different regions, you say, where are a lot of the cases coming from? 79% of the cases are coming from Southern Africa. 14% of the cases are coming from Northern Africa. 3% from Eastern Africa, 2% from West Africa, and 2% from Central Africa. So a majority of these cases are being driven from the situation we are seeing in South Africa. The following 5 countries are reporting the highest number of new cases: South Africa with 70,000 cases, Egypt with 66,000, Zimbabwe 5,000, Libya 3,000, and Tunisia 1,500 new cases. In terms of deaths, and these are new deaths, we have over the last week we recorded as a continent 1,776 new deaths, 1,076 new deaths, and this is slightly up from last week's number where we reported 943 deaths. And this represents a 14% average increase of total number of deaths compared to last week. If we now look at the 4 weeks changes over the last 1 month, we notice the following trends. In terms of new infections, that is people that are newly diagnosed, there are an average increase of 44%. Then in terms of deaths, new deaths, we've seen an average increase of 1%. Very interestingly, Nigeria is now reporting about 100% average increase, Kenya 72% average increase, South Africa 20%, Egypt 3% decrease, DRC 23% decrease, and Ethiopia 7% average decrease. In terms of testing, a cumulative number of 83 million tests have been conducted on the continent. Last week alone, about close to 970,000 tests were conducted on the continent. It represents a slight decrease of 14%. So let me just comment on the events that Wayne mentioned. This week, that is Monday, Tuesday, we hosted Africa CDC, the African Union, and the African Continental Free Trade Area hosted a very successful meeting, and I'll include that AU NEPAD, a very successful meeting on the progress we have made since we convened in April on vaccine manufacturing on the continent. Over 16,000 participants attended, including President Kagame in person and several representatives of head of states from DRC and Egypt. Overall, the head of states noted with pleasure and welcomed the progress that the continent has made in progress towards vaccine manufacturing. And I'll list some of them, starting with South Africa, where you know that they reported on the license agreement that Johnson & Johnson has now signed. Sorry, the Aspen has signed with Johnson & Johnson. The BioVac and the Pfizer agreement to produce mRNA vaccines and the vaccine manufacturing hub. Then you go to Rwanda, where Rwanda and Senegal have now signed an agreement to produce mRNA vaccines with BioNTech. It's been very, very successful. Then you go up north to Egypt, where Egypt reported that they are currently producing about 3.5 million doses of vaccines. That is the Chinese vaccines. And in the very coming months, we'll be producing their own vaccines called COVID-Vax. So I think that was remarkable to hear that what Egypt is already producing. And that is why we thought that the meeting must be co-hosted by the Continental Free Trade Area, so that as these countries produce the vaccines, there's a market there across the continent. We also knew that it was important to have a continental regulatory approach, so that vaccines that are being produced on the continent will actually go through a rigorous continental regulatory process, and then provide their stamp of approval, and then the CFTA will create a market for that, and the vaccines will be sold. I think that was the whole mechanics governing the meeting there. Then Senegal, we go on to Senegal, where we see they reported vast construction sites, and I was there 4 weeks ago to see the construction sites of mRNA vaccines and other vaccines produced there. Nigeria presented a roadmap on vaccine production in that country, as well as Ghana discussing their plans. So I think it was a very well attended meeting with a remarkable progress since we met in April 12 and 13 last year. So I think that a communique will be issued very, very shortly. But so just read that, and I hope we can discuss it further. Let me just conclude my briefing by giving you an update on where we are with the vaccines acquisition on the continent. A total of 431.9 million doses of vaccines have been procured on the continent, of which 245 million doses have been administered. For people that have received their double doses, about 7.35% of the population have received their double dose of immunizations. Morocco, Egypt, South Africa, Ethiopia, and Algeria continues to make very good progress so far. So I believe that is the summary of what happened over the week. I will turn it over to Wayne to facilitate the question and answer session.
Thank you very much. That was Dr. John Nkengasong of the Africa CDC, bringing us not just the situation of the epidemiological situation of COVID-19, but also a lot of progress that has been made on the African continent. And that was reported at that conference that was held in Kigali in Rwanda from the 6th to the 7th of this month. Let's now go into your question and answer section, but perhaps let me just give you that WhatsApp number for you to send in some of your questions, and it is +251 94 550 2310. But you can also chat to us live and send in your questions through the question and answer section. All right, let's now look at people who want to ask their questions live. And first we have Paul Adepoju. Good morning, Paul. Please go ahead with your question.
Thank you very much. So good morning, Dr. John. So I have a couple of questions. The first one has to do with an issue I'm having reconciling vaccination data available on Africa CDC's website for one country, Mozambique.
Paul, you're a bit low. Is it just on my side or?
Hello? Is it clearer now?
Yeah, it's just, we can hear you, but it's just low. We have to strain a little bit.
Okay. So I said I want clarification on data regarding vaccination on Mozambique. On Africa CDC's website, he said Mozambique has administered nearly 11.1 million doses, but the supply vaccines stays at 10.8. So which means the country has administered more doses than is registered on the website as being acquired. So I don't know if we can have explanation for that. Then Eritrea seems to be the only country in Africa that has not started COVID-19 vaccination. I'd like to know if there is an update on that. And my other question has to do with countries, African countries like the DRC, that has a wide margin between the number of doses acquired and the number of doses that they've actually used. I think it's just they've been able to utilize just less than around 5%. So what is the plan to ensure that vaccines acquired are not, that the country is not using, is not wasted? So I want to know what is being done. Maybe there is a distribution strategy in place, or what is the plan? And my second to the last question has to do with sequencing.
Sorry, Paul. Yes. I think that's enough questions for now. Let's give Dr. John the chance to answer them, and then perhaps you can come back after other colleagues have asked their questions.
Thank you.
All right.
Thank you, Paul, for taking the time to check on our website. I really am pleased to know that you look at that. And because I've not checked it myself, let me take that as an assignment and get back to you next week or even before next week. So I'll let my colleagues who are on here to promise and to take note of that question that you raised on Mozambique, and we reconcile that and email you that, or discuss it next week, or do both. so that everybody has a chance of hearing how those numbers tie up together. For Eritrea, you are right. Eritrea is the only country now that has not joined the family of 55 member states that are moving forward with vaccination. But we are not giving up. You remember some few months ago, it used to be 3 countries that we were challenged with. But today we are left with 1. And believe me, our policy and philosophy of leave no country behind is valid. You recall that I personally had to go to Tanzania to discuss the situation, and will not relent on going to Eritrea if need be. So just bear with me, and it's always a process. We are not giving up. In terms of DRC and other countries that are challenged, know that the initiative that we launched together with the MasterCard Foundation called Saving Lives, Saving Livelihoods is up and running. And we had in the past weeks, and including today in Rwanda, have a large number of countries, including DRC, that we are discussing with them ways to support them, developing precisely what we call micro-planning. And last week, a team was in Morocco with another set of countries, about 16 of them, to discuss micro-planning. So in the coming month, it's actually starting January, you see us increasingly engaging with countries to provide them with very specific technical support to advance their vaccination uptake. So I think that is a work in progress. We acknowledge the low uptake of vaccines in DRC, but be assured that we are working hard with the authority, the government of DRC, to using our Saving Lives, Saving Livelihood initiative to support them and other countries as much as possible. I think those were the questions that Paul raised.
All right, so we'll come back to Paul a bit later on, but let's move on now to Sophie Mukwena, who is with the SABC. Good morning, Sophie, and please go ahead with your question.
Good morning. Dr. Nkengasong, the issue of Omicron has caused so much damage in terms of the economy of the southern region. After major countries, particularly your developed north, took a decision to impose travel restrictions. But what was even disappointing to the citizens of the southern region, that is SADC, and the other countries, including South Africa, that had to deal with or are still dealing with the travel restriction, was that some African countries, and I will call out Rwanda in particular, did what the North and the developed countries and some in Asia has done, to the South by imposing tough measures against South Africa and the other SADC countries. What is your position, which can even lead to a situation where transportation of much needed medical assistance and tools and technology not being able to reach a country like South Africa, where sequencing is done, and the scientists in South Africa have actually saved the whole world, but a country on the continent just followed what the North did. What's your reaction?
No, so let me, Sophie, respond as I've been consistent all through this, that first of all, we should recognize the extraordinary work that the scientists in South Africa did. And we really give them a shout out of congratulations, tons of congratulations from all of us. The network that we've established for pathogen genomics, that is monitoring emergence of new variants of COVID, is working, is at work. And Africa CDC is proud to be part of that network, and actually the orchestrator of that network. The second credit I would like to give is to the leadership of political leadership of South Africa for coming out in a timely fashion and also in a very transparent way to announcing these results. They didn't hide it. That's what we all have been calling for: timely and transparent and accurate sharing of information. Now, what happened there, we've been discussing in terms of the reaction. After that, I think we've discussed that all over week. The Africa CDC was the first to issue a statement cautioning that in the history of this pandemic, the restrictions have never prevented the spread of these variants. And I think I would like to refer you to that statement, and that I think we were right. And I always hate to say this, what I'm saying, that we were right, because now we know that so many countries in the world have now reported the cases of Omicron. You asked my position. Africa CDC is a specialized technical agency, and our views were expressed in that communique. The African Union, which is the overall modern organization, has now issued a statement. And I think I'll refer you to look at that statement, where they are urging that the restrictions should be lifted because of the economic damage that it is having on countries. I think it's a very detailed statement that the African Union has issued, and I'd rather refer you to that statement. I work for the African Union, and I can, of course, submit to what they have issued there. So, Sophie, I believe that statement was issued today or yesterday, so that will be the best source of information. Thank you.
All right, thank you. I think let's go to a question that has come through our question and answer section. And it is from SABC again, and this one is from Sarah Kimani. And Sarah says, what measures have been put in place to ensure that there is no wastage as the vaccine doses are arriving into the continent in more numbers? Did the Africa CDC work with African countries to ensure that there is infrastructure that is vital in getting the jabs into people's arms?
Yes, so let me start with the second part of the question. For months, since June, we have been working with countries, over 40 countries, as part of the Saving Lives, Saving Livelihood Initiative, which is a $1.5 billion initiative to prepare countries and to develop their plannings for that. So this has to be both us as a technical support agency and the country showing leadership as well. I think that is what is clear. The second thing we've done, which I'm sure you've seen the communique, is to provide guidelines to the countries that are donating vaccines to say, look, don't give us vaccines where if the expiring date is very, very short, because that will become problematic in terms of uptake of the vaccines there. So that guideline, you can also see that together with WHO, Gavi, and UNICEF, always co-signatories of that guideline, because some of the challenges that we're having in terms of number of vaccines received and number of vaccines that are actually expiring is because of the short notification. The other issue is the coordination, lack of coordination. So if countries just say, wake up in the morning and say we are sending 10 million doses of vaccines to Africa, that doesn't help with the planning. We've always heard that, the kind of exercise that we did with the US government, where when they wanted to ship out vaccines, they did a very detailed planning with the AU, with the AVA team led by Mr. Strive Masiwa. It was a very fine planning that went on for about 2 weeks. And in the end, the vaccines were properly received. That is the kind of discussions that we are saying countries should. So engage with us, engage with the African Union, engage with AVAD so that we can do the effective planning and understand which country already still have some vaccines and where can these vaccines go and be easily used and whatever. That is the kind of exercise that I think we should be aiming for. And we encourage all donor countries to work with us in a coordinated fashion. Maybe I should just go back to the question that and provide additional information on what the question on the lockdowns or travel restrictions. Again, just to say that we want to believe that the initial restrictions were because the countries wanted to understand what the virus will behave. And now we are beginning to see have some tendencies there. And so again, we are urging that countries, as stated in the African Union communique, that countries should really be considering lifting up the restrictions.
All right, thank you very much, John. We go back online and we say good morning to Duduzile Ramela, who is with News from Africa in South Africa. Dudu, good morning.
Good morning, Ms. Lynn, and thank you so much. Dr. John, good morning, and thank you for the updates. It's quite encouraging to see that some countries are setting up facilities to make our own vaccines, yet in South Africa, vaccine hesitancy is quite high, with some sectors of the population believing that perhaps we should make it mandatory. I'd just like to know the thought of the CDC on this. Should it be mandatory, and which other African countries are looking into this as well? And just a note, I recently traveled to Senegal last week and going through 3 countries. Not once was I asked for a vaccination certificate just for my PCR test. Could this also not lead to, vaccine hesitancy, people asking why should I if I never have to produce it while traveling on the continent or within the continent at least? Thank you.
So very, very important question. I think the first thing should be that we should all use various influences that we have on in the society to get people to get vaccinated. We are not going to win the war against this pandemic if we are not vaccinated, period. I mean, and especially in Africa, if we have been fighting very hard with all of you for almost 2 years, we have been on this forum with you all fighting for access to vaccines. And if the vaccines are now coming in and our people are not receiving the vaccines, then it will become extremely unfortunate. And we cannot win this battle against COVID-19 without vaccination, period. So I think my first order of business will be to continue to appeal to the citizens of Africa to get out there and get their vaccines. The second thing is that if people do not do that, then governments would not have a choice other than to impose a vaccine mandate to people. I think some countries are already doing that, and it will not be the first. Africa will not be the first to impose the green pass. I think that is we've seen that work in some developed countries, but we don't need to get there if we just do the right thing. If you recall, I've been calling for everyone to sign a social contract with a social contract that says, I need to get vaccinated so that I can protect myself, protect my community, protect my loved ones, and protect my country. For how long shall we be going on with the lockdowns and then easing down, then lockdown again? And what is extremely damaging. Each time we go through this series of lockdown, it costs us about $30 billion. So, and we really are beginning to see vaccines arrive. So we should really go out there and get vaccines. So, on the question of a vaccine pass across the continent, that has not yet become a policy across the continent. And I understand that unto this moment, vaccines were very limited. Access to vaccines was limited. And if countries were imposing that across Africa, then no one will actually be traveling. But I would not be surprised that in the coming months, the leadership of the continent will begin to ask for that, for vaccine passport to travel. So again, please do not be, let's put our hands together, all hands on deck, so that we can use our different channels, different networks, and different opportunities to encourage the continent to get vaccinated at scale, so that we don't need to get to vaccine mandates.
All right, thank you, John. Let's say hello to James Chege, who is online. James, please tell us your news organization and then ask your question. Good morning, James Chege.
Good morning, Doctor. I have a question on COVAX supplies. I'm a journalist with Reuters News.
All right. Please go ahead.
There's a report from India about serum cutting output.
And we come out of that briefing by the Africa CDC. Some interesting numbers coming out of there. The latest infections on the continent, the highest, South Africa at 70,000 infections this week, and Egypt trailing at 6,000, followed by Zimbabwe and Libya and Tunisia at 1,000. Let's take a break.